morning, everybody. First off, I think I just want to start off with a disclaimer that even though I'm involved in health policy and at different levels, but this is really an independent presentation based on my experience. I've only ever worked in healthcare and have worked really on all sides, as an entrepreneur on the pharmaceutical side and executive on the medical scheme and hospital levels. I will touch base on the challenges that the industry faces, which is why we're looking for solutions, and why blockchain is particularly suited for healthcare, certainly in my opinion. And we will focus on electronic health records. You will see there are quite a lot of areas of application, but I think the electronic health record is the engine of what can be done to improve the problems within healthcare. And number 5, there is the ultimate objective. What is it that remains the holy grail that if we strike right, will solve a lot of the problems that we have in healthcare? And I thought it would be a missed opportunity not to address you as tech experts and financiers regarding, it's really just a friendly warning that for all of us as patients, let us not miss the opportunity as far as healthcare is concerned and what blockchain can do for healthcare. Sonia did alert me, I wasn't aware that I'm the only one who's speaking about healthcare. I hope next time there is a conference like this, there'll be far more talking about healthcare. So it's really about sensitizing all of you. And what are the pain points? I've broken these into 5 really about the key stakeholders, but also the systemic issues. It's really about patient confidentiality that speaks to itself. It's about the high cost of care. We know locally, just subscribing to a medical aid scheme is expensive. That's not enough. All your benefits expire before the year is over, and you still pay a lot more out of pocket, even though you have cover. It's fraud. The Board of Healthcare Funders estimates that we pay anything between 8 and 24 billion a year on fraud, and inefficiencies up to 40 billion. And we do have big issues about medical records that aren't interoperable. I will start off by just doing away with the ugly rumor that's already circulating that I wrote today's front cover. I didn't. It's a reflection. It says what medical aid scams cost you. It's just a reflection of the daily life in healthcare. The opening line, up to 25% of the money you pay for your medical aid is lost through fraud, corruption, abuse, costing the sector over 22 billion rand a year. 22 billion rand a year. And that's just outright fraud. You're still talking about inefficiencies. We know about this. I go see a general practitioner, he takes x-rays, he sends me to the lab, he refers me to the specialist, who then does exactly the same results that I did 2 weeks ago, and that's a cost to the sector. Medical malpractice litigation is a big issue. You may not know that in South Africa we're losing 50 to 100 obstetricians a year, simply because it's become completely unaffordable. A lot of them either leave or they just stick to the gynecology part of their practices. It's no exaggeration that some of these specialists are looking at about 1 million rands a year in terms of premium, just for medical litigation cover. The Minister of Health is on record many times saying we now have to reserve as a country about a third as liability in terms of provision for medical malpractice litigation that's happening in public sector. Patients, we are all patients, all 7 billion of us, and we don't own our records, which we should. We have no control of our record of who sees them, even when we want them to see them. They are not portable, and we are the only stakeholders as patients who do not benefit from this medical data that we generate on a regular basis. If you go and change your service provider, it always means you start again in giving your details. Why does this have to be? And practitioners, again, have already touched on the issues of medical malpractice litigation. The records are not interoperable, which isn't just it's not a convenience issue, it's a patient safety issue. Wherever I am, any practitioner that attends to me should be able to see my entire health record. It doesn't happen. And why blockchain? I don't know what happened here. But this slide was supposed to show about, IBM says they've identified 20 use cases. I'm not sure how they worked that out. My assumption is that it's even more, because I attended a conference in the United States, and it was very clear that within the health insurance system alone, they identified 18 different applications. But the slide is supposed to show as well that the pharmaceutical industry, blockchain is absolutely critical in terms of avoiding the whole point about counterfeit medicines and substandard medicines. The clinical trials industry on its own is undergoing a lot of change in regarding this, because for the first time, blockchain will have the opportunity to bring the practitioner closer to the patient without an intermediary who tries to bring the parties together. I've focused on the electronic records, as I said, because it is the engine of what needs to be done. The current electronic health records, they're not designed to manage multi-institutional lifetime records, meaning the very best among service providers for health electronic records are in a silo environment where they only have access to their patients, and they do not see what else is available. Time delay, even if you are going to request your record from your doctor, you try and see how long it will take you. It's impossible to have that done immediately if you do need to consult different service providers within a short space of time. The issue of there not being interoperable is a big problem, and let us not forget that there are players in the ecosystem who actually benefit from stopping that flow of information. If I'm a medical scheme, it doesn't help me to have another potential administrator to have access to your record, for example. Poor data quality, because proper data quality can only be ensured if you can see the entire life of my medical history, not just one moment in time. And the issue is that they are subject to hacking because they're all centralized. Here, this was supposed to be, again, a nice picture that shows the doctors' opinions of electronic health records and how they are not working. This was a 2018 study that was conducted by Stanford Medical School and was presented by the then American Medical Association president, basically explaining the problems with why they are not interoperable and why they're asking industry to come in and intervene, showing how it drives burnout, how it really just interferes with doctors when they actually see their patients. You either sit and type on the computer while the patient is speaking, or if you engage the patient, it means only in your after hours at night, then you start catch up with medical records. It's the only sector that still works like that. And here is a prototype of an electronic health record that's really based on blockchain. It was driven and published by the MIT in collaboration with Beth Israel Deaconess Hospital, which is part of the Harvard Medical School system of hospitals. Now, for someone like me, what was interesting here is that it's based on 3 types of contracts: registrar, summary contract, and patient-provider relationship. What was interesting for me is that on the patient-provider relationship, you have, let's see here, provider B. Not only does provider B, of course data belongs to the patient, but provider B has got stewardship over the patient records, but has viewing rights on provider C's records. This is important for our sector, and it's only through blockchain that we are able to see it. Now, I'm really sorry we can't see this, because this slide shows exactly what the goal should be, and that is patient centricity. It has in the center the patient and the whole myriad of service providers who basically need to interact with the patient. And the patient centricity that we're talking about is that blockchain will enable the patient to have access to their own data, can give permission who sees the data when, and can revoke that permission over time. And it works. It's important because this is probably the wrong place to say this, because as all in finance, you quite rightly believe that blockchain is everything, but trust me, blockchain was just made for healthcare. It's more useful there. And because healthcare is really just defined about exchange of sensitive patient data. It's about a single point of reference where records are immutable, are as up-to-date as they can be, and you need to facilitate quick payments for services. You need to eliminate waste and fraud. And the issue is that all of these systems are necessary. Incentive systems are necessary to increase network participation, which takes us to the area of ideally where you look at utility tokens. And in terms of what's new, for the first time, it would give patients and practitioners new income streams that are only possible because of blockchain. Now, why should you pay attention this time? I'm talking to you again as financiers, investors, and tech specialists. It's because the question has to be asked, is there anything really that will help with the transformation that is sorely needed in healthcare? I will just take a few slides to round up now my presentation, but within health sector, it is accepted that internet passed us by. I don't know whether internet missed us or we missed it, but healthcare has not benefited to the extent that it can. This is the reason why practitioners are saying, this thing is not working for us. It's just too much of a hassle. Now, I'm here to say, do not miss this again now. Let's not let blockchain miss healthcare or healthcare miss blockchain. For those who are more interested on the investment side, it used to be that healthcare was really just about defensive stocks. You couldn't go wrong in bad times if you had hospitals, if you had pharmaceutical companies. But for the first time, we're seeing healthcare driving new investments through R&D, through patents, and it is a sector to look at. But there are also reasons why the sector has lagged in terms of technology. I must specify here that when I'm talking about technology, I'm not really talking about the interventional clinical equipment. Of course, if you're talking keyhole surgery, if you're talking eye laser surgery, that's happening. I'm talking about managing the business of healthcare. That's where we're falling behind. But other reasons, here are some of the reasons. One, it's regulation. Other people are turned off by the fact that healthcare is regulated. It has to be. It has to be. You can imagine what you don't want to do is if you are in an accident with a serious head injury, you are taken to someone who will just say, look, maybe we should let him die and then we'll just resurrect him because it's cheaper. So regulation is important. As doctors, we are not blameless. We tend to believe we own the patient. We still insist that even a follow-up consultation should not take place on Skype. I still need to see you in my rooms. You do not want the pathology sort of test that can be done at point of service. But the American Medical Association has seen the light, and the words I took from the conference was when the president says they are engaging the Apples, the Microsoft, to now have healthcare sorted because they want to follow the airline industry. In an airline industry, you wouldn't be comfortable if you walked into an aircraft and either the pilot or technology is missing. It's difficult to raise funding. I've been in a pharmaceutical venture, and the difficulty of explaining to the funder what needs to happen, the only thing that's worse is that you sometimes see that the interest isn't there. Healthcare is changing. It used to be neatly packaged into the three areas of funding, of provision, and products, which is pharmaceuticals and devices. It's not that anymore. Transformation is already happening. I've spoken about focus, realignment, but we see healthcare gone digital. Accenture, in that book about healthcare is disrupted, explains how your conventional medical companies like your GE, Philips are in partnerships with the IBMs, where they are now looking more outside of the hospital for provision of healthcare. And there's also the digital gone healthcare, where your big tech is now looking into healthcare. Now, if you don't believe me, but you must then ask yourself why these giants are looking into healthcare. It's obviously, these are entities that have got budgets, research budgets that equal entire economies of small countries. And it's about the size of these markets. Everybody seems to have woken up that in the US alone, we are looking at a $3.5 trillion industry. In South Africa, medical scheme alone is 160, and that's just 8.5 million we have got cover. On the continent, we've got 200,000 doctors serving 100 billion people, and that's just doctors. I haven't started counting the other 10 categories of professionals, your physiotherapists and audiologists. And the difference with the digital gone healthcare, they bring their own patients along. It's my son who will hop on one leg to school if his iPhone tells him that's what he must do. Now, when I speak to my colleagues, I say, welcome to your new competitors. Healthcare is no longer local. It's no longer the hospital that's there. And all you need is blockchain to complete the final step, in my view. And this last slide, I'm just saying, I'm not talking use cases. I'm talking transformation of the sector and how it works. We've spoken about patient empowerment, reduction of costs, new income streams, but the alignment of the industry, medical tourism, if it doesn't matter where I am, my record is following me, there's a lot that even on the continent we can gain. Medical scheme administration, this is what I'm talking about. Certainly the most influential player, I'm not saying tomorrow, but over time, that trust relationship that they play has to be questioned. I've spoken about clinical research organizations that coordinate clinical research. It's questionable if that also will work in the long term. The sector is really ready for transformation. Until Discovery in '92 came on board, there hasn't really been nothing else really. What drove that? That was just an excellent product design, which was implemented successfully, and we all see what's happening. In a few short years, Discovery are having to explain if they are not too dominant. But blockchain is what, in my view, should bring the opportunity for new players and new models of how we work. And what is relevant for you here is that the winners, in my view, will not be traditional health sector players. Will not be. They are already too invested with legacy systems, and if they're winning, why should they change? But the difference is that what we are seeing in blockchain, the new entrants are startups who just niche very certain specific parts and work with established players without any issue of legacy systems. It's no coincidence, in my view, that among the players that are taking blockchain forward, it's the small country, little Estonia with 1.1 million people. It's, I don't mean to, I don't know how to say this, but it's the Georgias, the Bermudas that are leading regarding the regulation, and bring it down to the local level. It's the tech, the small startups who are going to make the difference. As I said, as technical experts and investors, do us all a favor and don't miss the opportunity. Thank you.